welcome to Mindful. I'm delighted to have the opportunity today to speak with Dr. Nilda Laboy. Today we're going to have the opportunity to talk about mental health services offered in prisons or correctional psychology. And I want to say that you're very well suited to this task, and I want to spend a minute for our viewers to describe your experience.
Sure.
You've been an expert witness in clinical and forensic psychology in courts in both Virginia and Massachusetts, specializing in states which are commonwealths.
Yes.
And also in the Federal Immigration Court.
Mm-hmm.
You've been a court psychologist in both adult and juvenile court clinics in this state, in Massachusetts. You have a private practice in forensic evaluations, and among the issues you have expertise in and experience are competency to stand trial, criminal responsibility, competency to waive Miranda rights, risk assessments, aid to sentencings, and sex offender evaluations. And finally, I want to mention that you've supervised students delivering clinical services during their internships at the Department of Corrections and at the Department of Youth Services for the past 8 years.
That's correct. Yeah.
Wonderful. When we talk about underserved populations, one of the populations that particularly sticks out is incarcerated individuals. You have considerable experience in this area, and it's a very different environment to deliver health services and mental health services. So could you lead by painting a little bit of picture about what it's like to be a provider in a setting like this?
Well, one thing to consider before we get into that is that it is said now that most of the mental health services in this country are provided in prison or in correctional settings. The Los Angeles County Jail, for example, is considered to be the largest psychiatric hospital in the whole nation. That's partly because of the institutionalization when people were, when psychiatric hospitals were reduced in capacity and people were discharged. Many of them went to the streets and they didn't have resources to fend for themselves or have gainful employment, and some of them committed crimes for getting food or getting a place to stay or trespassing, and then they were arrested, and that has continued happening to this day. So many people who get arrested even for petty crimes, they end up in jails, and what prompts that situation is their mental illness. Providing services in that type of environment is very challenging for many reasons. One is that the main purpose of place of incarceration is to provide security, right? So security is paramount, and it doesn't matter what's happening. If there's a security issue, everything else has to stop. So you could be in the middle of a session, you could be in the middle of a crisis intervention, and if there's a problem, they go on lockdown, and you may not be able to see the person again for the rest of the day. On the other hand, the political reality is that people who are incarcerated are not a priority for anyone. So you don't run a successful political campaign by saying, I'm going to provide more services to those incarcerated. And every time that there's budget cuts, one of the things that goes first are services for people who are incarcerated, forgetting that if you don't provide necessary services to those individuals, when they are released, they're going to go back to the community and they're not going to have a chance to do well. There has been an effort in the Department of Corrections to provide necessary services for inmates. Every DOC facility here has a mental health team. Many of our students over the years have served as interns in those teams. They do assessments, they do individual therapy. Depending on the facility, they may do group therapy as well.
You mentioned how a session may have to be interrupted because of a lockdown. I'm also thinking about something that correctional psychologists must think about frequently, which is about privacy.
Yes.
Could you comment on privacy issues?
In a correctional setting, if an inmate discloses something that will impact the security in the facility, you have to stop the session and make a report immediately. I would say it's non-existent. And that's something that you have to explain to the inmate at the outset of your interactions with them. And they're very well aware of that.
In psychotherapy in general, we talk about the importance of building a treatment alliance, of
Yes.
building trust. These are often men and women that have good reason to be careful about whom they trust. Can you say something about the trust-building process in offering psychotherapy with this population?
A couple of things to consider is that there's a lot of turnover sometimes in facilities, and when there's not a lot of turnover, the interns turn over every year. So you can be assigned, if you're an inmate, you can be assigned an intern, work with them for 10 months, and then you will have another one next year. So the nature of psychotherapy is also different in that you don't go into very deep themes. For example, many of the individuals who are incarcerated have a history of trauma or complex trauma, and it is not the purpose of therapy to go into that and to heal that trauma because the environment is not conducive. The focus is on helping the individuals with coping skills to adapt to the environment, or for example, if they have, it's more like targeting the symptoms. For example, if someone has insomnia, then you deal with them and teach them how to have better sleep hygiene. If someone gets angry very often, then you teach them coping skills, how to deal with anger, how to perhaps use breathing techniques, meditation, and other things like that. But it's not, you cannot engage in profound psychotherapy in a setting like that because there's no support to deal with all the things that people go through when they engage in that process.
And you had mentioned the issue for someone that has a life term.
Yes.
Could we chat about that?
So in some facilities there are prisoners, inmates who have been sentenced to life. And of course, life means different things in different places, right? Some people who have life sentences may be able to get out in 25 years, depending on the situation, depending on if they're parole eligible or not. But some people know, also depending on their age, that most likely they're never going to go out. There is work to be done with them to help them adjust to that reality and to try to find purpose in their life even when they're incarcerated, because many of them say, well, what's the point of being here if I'm never going to go out again? What do I have to look forward to? So there's a lot of work with those individuals in terms of trying to find purpose.
Along those lines, we were talking a few minutes ago about that the targets in psychotherapy are different in this setting. How is suicidality managed?
It seems that the higher the security level, the most likely people have more either suicidal ideas or attempts. There are protocols established to monitor people who express suicidal ideation that include constant eyes on them. They are placed in a different cell. Sometimes their garments are different. They are given paper gowns instead of their regular clothing, and they're not allowed to have anything that can be used to harm themselves.
Mm-hmm.
So it's not unlike psychiatric hospitals,
Mm-hmm.
but in a more secure environment.
Okay. So let's shift our conversation to the issue of families.
Mm-hmm.
Many incarcerated individuals have minor children at home.
Mm-hmm.
They have a long-term partnership or marriage that they hope to sustain. What are some of the themes that the counselor psychologist deals with around maintaining family relationships?
We have to also make a difference between people who are in a jail or a house of corrections versus people who are in prison. So people who are in jails or house of corrections are there because they're either detained while waiting trial, or they have sentences that are less than 1 year and 1 day. When you have a sentence that's more than that, then usually you end up in a Department of Corrections facility, in a prison, state prison. In terms of services for women, Massachusetts has one state prison for women, which is the facility in Framingham. There's many women who go to Framingham who have very small children. Some of them even give birth while they're in prison, and then the child has to be relocated to somebody, family member or foster care. I remember going to Framingham to do an evaluation of an inmate, seeing all these social workers outside in the waiting area with very small kids, 1-year-old, 2-year-olds, who were there to see their moms. I think they're more thorough at that facility than any other facility I've visited before. In terms of checking you for contraband. The other thing is, it's not only difficult for the person who's incarcerated, but for the people who are left behind at home that don't have. Many families lose a breadwinner. Their financial situation changes drastically by that person being incarcerated. So the kids of those individuals then experience deprivation in other ways, so they're not only missing their father or their whatever relationship they had with the incarcerated person, but they also face poverty and other problems. In addition to that, people get incarcerated, that doesn't mean that they are in a facility that's close to where the family lives. So for some people it's prohibitive to go visit because they don't have transportation or they don't have the money to go. So that puts a strain in the family relations. The reality is that a lot of the relationships are strained or are broken because people stop visiting, they stop calling, they stop showing interest, writing. And so many of the incarcerated people also feel that they don't count anymore, they're not part of the family life anymore. There's the issue of so many inmates that receive the divorce papers while they're in prison, and they have to deal with that.
I'm aware, because we get inquiries from psychologists who are chiefs at either a prison or throughout a state system, and they say they have a very difficult time hiring professionals to join their team. And I contrast that to the fact that the forensic program in the counseling department is very popular. Mm-hmm. In part, you have a very talented faculty, mm-hmm. but students are really attracted to careers on the forensic side of the spectrum, yes. Less so on the correctional side. What's your thoughts about how we might further build teams within prisons?
Well, my experience has been, during the years that I've been here, in the beginning there were a lot of people interested in what I call the CSI effect, right? They watch CSI on TV and they think that studying forensic psychology or forensic counseling, that's what they're going to be doing, solving crimes and dealing with serial killers and things like that, which is not the case. But lately, I would say within the last 5 years, we've received a lot of candidates and a lot of people who end up coming to the program who are really committed to serving people who are incarcerated, because they have identified them as an underserved population, and either they have had experience with either relatives or neighbors or people they've known who have been incarcerated, and they see the need that exists in the system, and they're very committed to providing these services. So I am glad that we have the opportunity to send our students to both adult facilities and juvenile facilities to work with these individuals, and many of them end up being hired.
So early at the beginning of our interview, you commented that in LA County, mm-hmm. this is the largest psychiatric hospital. Mm-hmm. So there's the thought and the conviction that many of these people have mental health challenges, mm-hmm. and this is really, in my thinking, the original community mental health system.
Yes. Yes.
I am really grateful to have this chance to chat with you about these important topics. We're going to wrap up in just a moment. A summary comment or a final reflection?
Sometimes it is disheartening to see that people who have significant problems when they're young are unable to get the help that they need, and then continue on a path that they get in trouble with the law because of those issues that were not proper. I'm not going to say not attended to, because they were, but not properly attended to.
Yes.
So I think that there's a lot of work to do. I think that we are committed to train individuals to provide these services. I think that the next step would be also to be more proactive in influencing legislature to make funds available to do the treatment that we know how to provide, but that we need the funds and the mandate to do it.
An excellent final point. Thanks so much for talking today.
Thank you for the opportunity.